of you to talk and try to solve the acid-base disorders. So let's start. So, Bismillah. So today we're going to talk about acid-base disorder. So the first thing is you need to memorize these values. So these are normal values that it's going to depend how you're going to calculate your acid-base disorder. So the first thing is your pH is 7.4. So don't, like usually there's a range from 7.35 to 7.45. But for the practice of acid-base disorder, we're going to make it as 7.4. Also for PaC2 is 40, bicarb is 24, and chloride is 100. So the 5 steps to acid-base disorder. صوتي واضح؟ Good. So the first step. So there's 5 steps you do, and we're gonna go to them one by one. And if you go by them and you go systematic, you're gonna solve every acid-base problem you're gonna have. Your first question is this patient acidic or alkalemic? So you want to ask, does he have acidemia in his blood? So is his pH is less than 7.4, or he is alkalemic and his pH is 7.4. Step 2, you're going to ask, is it a primary respiratory problem or metabolic disturbance? And how you're going to know this is the relationship. So in respiratory disorders, the pH and PaC2, your partial pressure of carbon dioxide, they're going to go in opposite direction. This is respiratory. In metabolic, they go in the same direction. So the most important thing is to look at your pH and PaC2. So if your pH go down and your PaC2, your partial pressure of carbon dioxide go down, so you're expecting to have a metabolic disorder. Okay, so after if we decided that we have, so our first step was acidemia or not. Our second step was, is this primary respiratory or metabolic disorder? Step number 3 is we're gonna ask, is there an appropriate compensation? And these you have to memorize. So I tried to make it as easy as possible. So in metabolic acidosis, your expectation is the decrease in your PaC2 will equal to a bicarb plus 15. Metabolic alkalosis, the increase in PaC2 should be equal to your bicarb level plus 15. Okay, the respiratory acidosis. In respiratory acidosis, every 10 increase in PaCO2, you expect your bicarb to be increased by 1 in acute and 4 in chronic. And in respiratory alkalosis, every 10 decrease in your partial pressure of carbon dioxide, you expect your bicarb to decrease by 2 or 5. Okay. Then you have your step 4, is there an anion gap metabolic acidosis? And you're going to calculate that by trying to, so it's your sodium minus your bicarb plus your chloride. And if the anion gap is more than 12, if the result is more than 12, you have an anion gap metabolic acidosis. Step 5, I'm going to explain it here, but you don't have to memorize it for the exam purposes. But I think it's very important, but there's no question going to be that's going to come on step 5. But I want you to understand it to see how you can solve every metabolic disorder. So if we finish step 1, step 2, step 3, step 4, then and the patient has metabolic acidosis, sometimes there's another metabolic problem. How are you going to do that? How are you going to know that is by measuring your delta gap. So delta gap equals your delta anion gap minus your delta anion gap minus your delta bicarb levels. and it's your anion, it's what you calculate from an anion gap, minus 12, it's the normal, and 24 minus your calculated, sort of measured bicarb. If this number delta gap is more than 6, usually they mean that you have anion gap metabolic acidosis and metabolic alkalosis. So you have two disorders. And if your anion gap is less than minus 6, so their mean is both anion gap metabolic acidosis and non-anion gap metabolic acidosis. Is this clear? You have questions؟ فهو أي واحد عنده سؤال أبغى يوقفني على طول ويسأل. Okay, so moving on. So the first disorder is respiratory acidosis. So your pH gonna be less than 7.4, and your partial pressure of carbon dioxide gonna be more than 40. So the most commonly happens in hypoventilation. So the more differential diagnosis include central venous depression. So somebody he's not breathing because he took some sedatives or CNS disease, or he have sleep apnea. So pulmonary diseases also like ARDS, COPD, sometimes large pneumothorax can cause this. Also, if you have an acute airway obstruction and you cannot clear your CO2, your like laryngospasm and sleep apnea, neuromuscular disorders usually happen, flail chest and ventilation dysfunction. Somebody on the machine, or he's intubated and the ventilator setting doesn't support him. So let's go. So the compensation, as we said, for every 10 increase in your partial pressure of carbon dioxide, you expect your bicarb to increase by 1 in acute or 4 in chronic. Sometimes if you have a greater increase, that means that you have the 2 disorders. So maybe sometimes if you have a great increase in your bicarb, you're expecting that there's metabolic alkalosis and COPD. If your bicarb is below than 24, you expect that there's a problem. There's a metabolic acidosis and a COPD. So let's go to our first example. So 70 years old smoker who presented with acute onset of shortness of breath. Your ABG shows a pH of 7.3. Your partial pressure of carbon dioxide is 60. And your metabolic panel as your sodium is 135, chloride is 100, and your bicarb is 30. So my first question, so what's the steps? Anyone want to try to take it? معايا يا شباب؟ Okay, I'll see the chat. طيب. So what's step number 1? So we need to decide, is this acidosis or alkalosis? So that's step number 1. So what do you think? Waleed is saying acidosis. That's below 7.4. That's true. So what's the next step? So the next step is we want to decide, is this respiratory or metabolic صح ولا لا? So we want to see, so we said we look at what? The pH and your CO2. So the pH, they go in opposite direction صح ولا لا? So your pH is going down, so you're acidotic, but your PCO2 is going up. So معناها ايش? This is primary what? Waiting for you guys. معناها ان disorder is what? Primary what? Exactly. So respiratory acidosis. So what's our next step if you remember? So step number 3 is we're gonna calculate, is there a proper compensation or لا. So if you remember, نشوف مين اللي فاتح المايك. So if you remember, so the المعادلة or calculation for this is every 10 increase in your PCO2, exactly 1 acute or 4 chronic. ممتاز. So هنا CO2 is increased by كم? 20 صح ولا لا? By 20. So you expect if it's acute, your bicarb should be كم? Yeah, if it's acute, it should be 20. Exactly, Ahmed. زي Ahmed said, is 26. So if it's chronic, should be كم? Your bicarb. So 4. So 8 زائد 24 كم? Yeah, 32. Exactly. So here, so زي ما قلنا, your CO2 is increased by 20, therefore your bicarb should increase by 2 if it's acute, or 8 if it's chronic. صح ولا لا? لأن الbicarb is actually between them. So it's 30. So it's neither acute, neither chronic. معناها there's an acute on chronic respiratory acidosis. So this guy usually, لأنه smoker and he has COPD, most likely, his normal bicarb level is most likely expected to be at maybe 28. That's his normal bicarb level. And then the chronic, and he had acute exacerbation. So that made him increase by 2 to 30. Is this part clear? يعني بس افتح الشات. So this is most likely it's an acute and chronic. طيب, our step 4, we have to do it every time. Is there an anion gap metabolic acidosis? So زي ما قلنا نجمع الصوديوم. So it's the sodium level minus your chloride and bicarb level. So usually your anion gap is 5. So if it's more than 12, so there's no anion gap metabolic acidosis. So most likely this guy has an acute and chronic respiratory acidosis due to COPD exacerbation. Okay. Moving on, so we started with respiratory acidosis. Our next step is respiratory alkalosis. So it's when your pH is more than 7.4 and your partial pressure of carbon dioxide is less than 40. Usually it happens due to hyperventilation, and there's many causes that cause primary respiratory alkalosis. Sometimes CNS diseases, intoxications like aspirin salicylate or aspirin intoxication, high altitude, severe anemia, pregnancy, lung diseases that can happen, sometimes asthma, PE, anxiety, panic attacks can cause an acute respiratory alkalosis, fever, and cirrhosis usually. So the compensation is X. So every decrease in your CO2 partial pressure by 10, you expect your bicarb to decrease by 2 in acute or 5 in chronic. So let's do the same. So we have this example. Let me just open the chat عشان أكون معكم. So I expect the same. So I want you to answer. So this is a 22 years old woman who presented with 4 hours of numbness in both hands, typical of her previous episode of anxiety. So her ABA goes as pH is 7.48, PCO2 is 30. Okay, her sodium is 140, chloride is 110, and bicarb is 22. So what's our first step? What's our first question? Is this what? So the first question is this acidosis or alkalosis? Yeah, exactly. So we want to see your pH. So what do you think this woman has? Exactly. So it's alkalosis. Okay. So our next question is this: is it primary respiratory or primary metabolic? So we want to look at what we're going to look at. Yeah, so there's a mistake here. So the bicarb is HCl. So I meant is bicarb. So it's 22. There's a typo here. Okay. So our next question is our next question is it respiratory or metabolic? So it's respiratory because the pH goes up and your partial PCO2 goes down. So they go in opposite direction. So the compensation, as we said, so every 10 decrease in PCO2, we expected to decrease it by 2 in acute and 5 in chronic. So there's 10, so you expected to bicarb to come to go to be lower by 2, right? So there's an acute drop in your CO2. So it's your normal level of bicarb 24 minus 22, so 2. So therefore you would expect this as an acute disorder, an acute respiratory alkalosis. So then your step 4, which is important, is you want to try to measure anion gap and see if there's any anion gap metabolic acidosis, and there's none. And usually this lady would have an acute respiratory alkalosis secondary to panic attack. So our next topic is going to be metabolic acidosis. Okay, so it's usually when your pH is goes less than 7.4, your bicarb levels goes less than 24, and your PCO2 goes less than 40. So metabolic acidosis can be further classified based on the presence of anion gap to an anion gap metabolic acidosis and non-anion gap metabolic acidosis. So don't forget the compensation. So your expected partial pressure of carbon dioxide will equal your measured bicarb plus 15. So if the patient CO2 is higher than expected, the patient has another problem with another respiratory acidosis. And if the patient's PCO2 is lower than you expect or you measure here, the expected PCO2, the patient has most likely superimposed respiratory alkalosis. And we're gonna explain this with more cases. So it's important to know if it's an anion gap metabolic acidosis because there's a couple of few conditions that commonly cause this. So, and we memorize this by the mnemonic MEDPILES. So MEDPILES, M stand for methanol and metformin, U is for urea, uremia, D is for diabetic ketoacidosis, P is for paraldehyde, I for iron and isoniazide, lactic acidosis, ethylene glycol, and salicylate or aspirin. So basically, even if your pH is 7.4, but you have a high anion gap, it means that you have that you have metabolic acidosis, because the body does not compensate for alkalosis by generating a large anion gap. Okay, so and don't forget we measure step 5, the delta gap, to see if there's an anion, if it's more than 6, if there's an anion gap plus metabolic alkalosis, like if you have a decay and you're vomiting, or if it's less than -6, you have both anion gap and non-anion gap, non-anion gap metabolic acidosis. So let's go for an example. So you have this 32 years old man who presented with depression and alcohol abuse. He comes with an altered mental status. So his pH is 6.9. His bicarb is 5. His CO2 is 29, and this is his other metabolic panel. So what's our first step? We're going to ask, is this what? Exactly. So the pH, is this acidosis or alkalosis? So it's less than 7.4, so it's acidosis. So our next question gonna be, or step 2 is this respiratory or metabolic? So we're gonna look at the pH and the PCO2, they go in the same direction. So this means there's a metabolic disorder, right? Then the next step is we're gonna measure the expected PCO2 level. So you expect it to be what? What's the number? What's the proper compensation? Your step 3. So it's your bicarb plus 15. So your expected PCO2 number would be what? Exactly, 20. So when we have it here is 29. What does that mean? So this is mean is most likely there's another respiratory acidosis. So it's higher than you expected, right? So there's a metabolic acidosis and a respiratory acidosis. Did you understand me? So if you, yeah, so if your expected partial pressure of carbon dioxide, let's say the measured one, we find it 15. That means is you have two problems. You have metabolic acidosis and respiratory alkalosis. But if the number is higher, you have metabolic acidosis and respiratory acidosis. Then our next step is to measure to know, is this an anion, is there an anion gap or not? And if we measure it, 140 minus 16, so your anion gap, so it's equals to 34, which is more than 12. So you have an anion gap metabolic acidosis. Then we do step 5, which is the delta gap. So it's your calculated anion gap 34 minus 12 minus the total of 24 minus 5, which equals to 3. So it's between -6 and 6, so there's no additional metabolic disorder. So most likely this guy has an anion gap metabolic acidosis and a respiratory acidosis because of alcohol toxicity. So our second part of the metabolic acidosis is the non-anion gap metabolic acidosis, and usually this happens because you either you lose your bicarb from either GI source or renal losses. So example of non-anion gap metabolic acidosis is diarrhea, because there's a lot of bicarb in your intestine and you lose them with diarrhea. Sometimes renal tubular acidosis, your kidneys does that. Sometimes if you take carbonic anhydrase inhibitors, so medication, sometimes if you have erythrodivergence, rehydration, potassium sparing diuretics, NSAIDs, or Addison disease, that you're gonna lose your bicarb. And let's get this example done. So you have a 60 years old man who recently took antibiotics for skin infection and presented with 10 episodes of watery diarrhea per day. for the last 5 days. His anion gap is, sorry, his ABG is, pH is 7.3, your CO2 is 34, and your bicarb is 18. So I think you know this already. So what's the first step? Yeah, pH. So is this acidosis or alkalosis? So it looks like an acidosis زي ما قال عبد العزيز. So our next step is we want to decide, is it metabolic or respiratory? Yes, it's metabolic acidosis. Your pH and PCO2 goes down in the same direction. Okay, so the appropriate compensation, what is your expected PCO2 level should be? Exactly. Yeah, so it's your measured bicarb level plus 15, so equals to 33. And what, so it's almost the same, 33. So what's your anion gap should be? So your anion gap, so you next step is you measure your anion gap is 9, so there's no anion gap. So there's no, it's non-anion gap metabolic acidosis, right? So most likely this guy has non-anion gap metabolic acidosis because he's losing his bicarb from his gut or due to diarrhea. Perfect. Annie, we're almost halfway. So last one is your metabolic alkalosis. It's when your pH is more than 7.4 and your bicarb level is more than 24. The causes of metabolic alkalosis are usually volume contraction, like vomiting. Sometimes when they do an NG suction, they take your HCl. Okay. Sometimes glucocorticoids or mineralocorticoids, like Cushing syndrome. Cushing syndrome, if the patient is taking steroids, or he sometimes alkali ingestion. So the compensation is the same. So it's your bicarb level plus 15. So let's do this example. So 20 years old, present with excessive vomiting after he's been binge drinking, and his APGs, his pH is 7.5, PCO2 is 44, and his bicarb is 30. So let's do this. I think we know by now. So first step is we look at our pH. Is it acidosis or alkalosis? It looks like an alkalitic pH is 7.5. So the next step is we're gonna look, is it primary respiratory or primary metabolic disorder? So the pH rises and the PCO2 also rises. So we think it's metabolic. So they go in the same direction, it means it's metabolic. So the next thing is we're gonna do the compensation, and we see our expected partial pressure of carbon dioxide or CO2. So it's your calculated bicarb plus 15. So it's 30 plus 15, which is 45. So it's almost the same number here. One difference won't make a difference. So that means this is appropriate compensation. And step 4 is you want to see if there's an anion gap metabolic acidosis. So you calculate your sodium minus 100 is your chloride plus 30, which is 8. So there's no anion gap metabolic acidosis. So most likely this guy has a metabolic alkalosis secondary to vomiting. Okay. So تقريبا Okay, so I want to. So now I don't want واحد يتبرع ويطلع بالمايك. You open the mic and talk and take the cases. ما نبغاها تكون بالشات. Okay. يلا مين بسرعة ياخذ case 1 and I'm gonna help you with it. ماجد بما انك فاتح المايك so it's gonna be you. ماجد معنا؟ شباب nobody ترى بختار أسامي إذا ما حد تبرع يطلع يسوي الكيس. I need volunteers guys. أنتم معي ولا نايمين؟ ماجد العنزي بما أن المايك open please talk. ماجد okay so clearly ماجد مو موجود so let's go to the next guy. So باسل المطيري. باسل معنا؟ اوكي باسل شكله مو معنا. طيب next guy فيصل. فيصل حباني. طيب باسل معنا على الأقل. طيب فيصل. اوكي فيصل مو معنا. طيب عبد الله سليمان. عبد الله.
هلا والله دكتور.
هلا وسهلا كيف حالك؟
تمام الحمد لله الله يحييك.
هلا والله. So للأسف أنا ببدأ بالأسامي ف it's gonna be your case. So I want you to answer. يلا let's go. So case number 1. So we have a diabetic patient who presented with diarrhea and cough. His chest X-ray reveals an infiltrate, so we suspect he has pneumonia. So his pH is 7.3, his PCO2 is 10, and his bicarb is 5. So وش أول for أول step كانت? What's our first question gonna be?
Looking for pH, visit acidic or alkaline.
Okay, so the acidemia or alkalemia? So what do you think?
It is acid.
Okay, so it's an acidemia. So what's your next step?
Next step, look to bicarbonate, and it is metabolic or as respiratory.
Okay, so what do you think is going on here? Do you think it's metabolic or respiratory?
metabolic.
Metabolic, exactly. So if you look your pH and your CO2, they go in the same direction. They're both decreasing, so it's metabolic. Okay. So choose step number 3. تتذكر؟
Step 3. Combination.
Compensation. Perfect. So المعادلة طبعا ما I don't expect you to memorize it by now, بس المعادلة is easy. You're measured by carb plus 15. Yeah. So the number that should come is your PCO2 should be 20. Is your PCO2 20?
No.
No.
20.
معناها ايش؟ إذا ما كان ومعناها ايش؟
No compensation.
Okay, so it's not appropriate compensation. يعني معناها there's another disorder صح ولا لا؟
Yes.
يعني yeah. So you expect your CO2 to come 20, but your CO2 is lower. So معناها أن عندك respiratory alkalosis because it's lower than your expected number. Okay, so this is step 3. So is it appropriate compensation? No, it's not an appropriate compensation. And الرقم اللي أنت تتوقعه is 20. So you have a respiratory alkalosis. طيب آخر step عندنا دائما نحسب. So it's a metabolic disorder. You want to calculate your anion gap. So what is your anion gap هنا؟ So أعطني المعادلة بس مو لازم تعطيني الرقم. أنا بعطيك الرقم. كيف تحسبها؟
I don't remember it, Doctor. No. Sorry.
Okay. So الاناين جاب كيف نحسبها؟ اللي هو الصوديوم ماينس مجموع الكلورايد والبايكاب، يعني معناها 123 ناقص 104 يطلع لك كم؟ It's gonna become 19. Okay, so this patient has a high anion gap metabolic acidosis, right? So the next step is we're gonna calculate is there another metabolic disturbance? And we have to do that is by calculating your delta gap. So it's 19 ناقص 12 ناقص 24 ناقص 5 اللي هو your measured by carb. So your delta gap is minus 12. معناها this guy has a non-anion gap metabolic acidosis. So he has another disorder صح ولا لا؟ So level اللي هو كم قلنا؟ 19 ناقص 12 ناقص 24 مجموع بيصير يعني level is going to be minus 12. So this guy he's a diabetic, so he have primary anion gap metabolic acidosis from DK لأنه diabetic وما أخذ his medication. He have respiratory alkalosis لأنه عنده pneumonia وقاعد يتنفس أسرع لأنه مكتوم. He also has diarrhea and he's losing his bicarb. So he have non-anion. He has a third disorder of non-anion gap metabolic acidosis. Okay. شكرا عبد الله.
يعطيك العافية دكتور.
هلا. يلا who's next؟ طيب أحمد رمضان.
السلام عليكم دكتور، عاد أشارك ولا تاخذ الأسئلة؟
لا تقدر تشارك. Anyone who volunteer he will get it. يعني if you do it you're gonna be better at it. بس إذا ما حد volunteer I will go by one.
Okay.
It's yours. The next case is we have a diabetic patient who presented with vomiting. His pH is 7.2.
سلام دكتور، ناديت باسمك. أنا أحمد رمضان.
إيه لا خلاص. It's okay. Okay, Abdulaziz. Yeah. So pH is 7.2. His CO2 is 25, and his bicarb is 10. So we want to take it from here. So وش أول step حق أول first step حقتنا؟
شوف البي اتش عشان نحدد هل هو اسيديميا ولا الكليميا.
Okay, perfect. What do you think is going on here?
تمام. البي اتش عندي هنا يا دكتور 7.2 فيكون اسيديميا.
Perfect. بعدين النكست ستيب ايش كنا نقول؟
ستيب نمبر 2.
إيه.
اوكي، بعد اشوفها هل هي ريسبيراتوري ولا ميتابوليك.
بالضبط. So what do you
تمام.
think?
ميتابوليك.
metabolic. Perfect. ليش؟
لانه واحد طالع نازله.
ايه yeah. So metabolic لأنهم they go in the same direction صح ولا لا؟
سيم دايركشن.
يعني your pH PCO2 كلهم يروحوا نفس نازلين صح ولا لا؟ لأن الرقم الطبيعي حق PCO2 اللي احنا نحسبه 40 صح؟
بالضبط.
وش step number 3؟
compensation.
compensation. المعادلة كانت ايش؟ حقت الميتابوليك.
السي او 3 بلس ال 15.
بالضبط. يطلع كم الرقم؟
25.
25. So it's the same number.
same number.
PCO2 same number. So
بالضبط.
معناها ان عندك
appropriate.
ايه وش step number 4؟
احسب الأونيون جاب.
حلو. كم بيطلع هنا؟ 130 ناقص كم؟
وش الصوديوم 130 ناقص 80 زائدا 10. اوكي، تطلع عندي 40.
بالضبط. طبعا الى هنا انا I'm happy with this. بعدين في step number 5.
اوكي.
is complete بس انك you want to calculate your delta gap صح ولا لا؟ عشان تعرف في another problem ولا لا. So delta gap calculation is you measure the anion gap اللي هو 40 ناقص 12 ناقص مجموع ال 24 ناقص يعني 14 يعني تقريبا it's gonna be around 14 number. معناها ايش؟ ايش معناها الرقم هذا؟ معناها ان عندي اول ديزيز اللي هو metabolic acidosis مع برضه metabolic alkalosis.
metabolic alkalosis meal vomiting.
Exactly. عافاك الله بالعافية.
يعطيك العافية.
Okay. Case number 3. Anyone want to take it?
السلام عليكم دكتور.
وعليكم السلام. هلا معتز. سعد؟ يلا بسم الله. So this is a man with arthritis who presented with confusion, shortness of breath, and diaphoresis. So his pH is 7.3. His partial pressure of CO2 is 18, and his bicarb is 16. Yalla. I want to take it from here. So what's our first step?
First step, look for pH less than 7.4.
معناها إنه
Acidosis.
exactly. So you have an acidemia or acidosis. Okay. Which number
Next
2?
Next step, CO2 and bicarbonate. Decrease same direction. Metabolic.
Exactly. So we want to ask is it respiratory or metabolic, which is metabolic. طيب step number 3.
Look for compensation.
تذكر المعادلة.
البايكربونات زائد 15.
خلاص يعني 15 زائد 15 expect النمبر كم يطلع؟ يعني what's your expected CO2 كم الرقم؟
31.
Exactly. والرقم عندنا هنا كم ايش؟
18. There is no compensation.
ايش معناها؟
No compensation.
ايه ما في compensation لأن معناها شيء معناها يعني الرقم اللي المفروض يطلع CO2 31 صح ولا لا؟
صح.
موجود عندي هنا 18 معناها المريض ايش؟ معناها المريض ايه عنده عنده primary metabolic acidosis معناه انه عنده another problem صح ولا لا؟
صح.
وش problem؟ عنده غالبا respiratory alkalosis قاعد يتنفس اسرع. انت لما يكون عندك metabolic acidosis you breathe faster عشان تطلع CO2. فانت متوقع ان جسمك لما يوصل الى 31 يهدى يحاول يحافظ على CO2 at 30. okay but you're breathing faster ف your CO2 is less than the expected number. معناها ان عندك ايش؟ عندك another disorder, عندك another problem which is respiratory alkalosis. لأن الرقم اللي المفروض حسبناه الcompensation هو 31 صح ولا لا؟
صح.
yeah. فإذا الرقم لو فرضنا أن الرقم إن CO2 40 معناه إنه عنده إيش؟ عنده يعني metabolic acidosis وعنده respiratory acidosis. بما أن الرقم أقل من 31 معناه إنه عنده metabolic acidosis وعنده respiratory alkalosis. Do you understand this point ولا لا؟ تلخبط
Yes.
شوي. طيب حلو. What's your step
نفس
number؟
ستيب الانيون جاب،
حلو.
الصوديوم ناقص الكلورايد زائد البيكربونات.
بالضبط. ويطلع تقريبا 23 فمعناه انه
more
ايش؟
than 12 anion gap.
Exactly anion gap metabolic acidosis. Okay. طيب step 5 طبعا اللي هو calculating delta gap. I don't expect you guys to know it. بس ان there's no delta يعني delta gap is between -6 and 6 so there's no other metabolic disturbance. So هذا غالبا لأن عنده arthritis it's a clue في الإكزام يعني غالبا إنه ياخذ aspirin for pain sometimes so he most likely have primary anion gap metabolic acidosis from الأسبرين. شكله أخذ aspirin more than his supposed dose. okay والaspirin by itself makes you breathe faster عشان كذا عنده another respiratory alkalosis. so this is a يعني expected number for salicylate toxicity. عافاك الله. شكرا معتز. Okay. So let's moving on. Technique number 4. في حد يبغى يحاول؟
السلام عليكم.
وعليكم السلام يوسف.
ممكن أشارك يا دكتور؟
أكيد حياك الله.
الله يحييك. طبعا في البداية لازم نشوف إذا البيشنت كان أسيدوسيس أو الكالوسيس. عندنا pH 7.18 أسيديميا أسيدك.
Perfect. Acidic. So شو step number 2؟
بعدين نشوف البايكربونات ونشوف نشوف ال CO2. طبعا البايكربونات 30 so this is a respiratory acidosis.
Exactly. It's respiratory acidosis. أيام أسهل إنك تشوف CO2. أنتم متعودين إنكم تشوفون البايكارب شكلكم بس sometimes it's easier. I don't mind which way you do it بس إذا كان أنا عندي إذا هم عكس بعض إذا ال pH نازل وال CO2 طالع معناه إنه respiratory disorder. إذا هم ال CO2 وال pH كلهم في the same direction معناها it's a metabolic disorder. ف this guy has زي ما قلت primary respiratory acidosis. So إيش ال compensation؟ تتذكر المعادلة؟
الكمبنسيشن البايكربونات زايد 15.
لا هذيك في الميتابوليك ديسوردر هذا عندنا respiratory disorder.
لا ما أذكر.
ايه فكل 10 increase in CO2 البايكربونات CO3 will increase أو يزيد by 1 in acute disorder or 4 in chronic disorder. صح ولا لا؟
صح.
هذه هي. Just give me a second. So الرقم حق ال CO2 اللي قلنا اللي احنا لازم نحفظه الطبيعي كم كان؟ 40 صح؟
40 بالضبط. 35 إلى 45.
لا 40 احنا حطينا عشان ما نلخبط حطينا الرقم 40.
تمام ممتاز.
تمام فالحين هذا there's يعني your CO2 increased by at least 40 صح ولا لا؟ So قلنا كل 10 البايكارب expected to be يعني so إذا كان acute you'll expect it to increase by 4. إذا كان chronic you're gonna expect it to increase البايكارب حقك by 16. صح ولا لا؟
صحيح.
فكم الرقم عندنا؟
It's increased by 4.
لا ليش؟ 4.
كل 10 قلنا تحسب له 1.
إيه هذا في الأكيوت معناها 24 زائد 4 كم؟ 28 صح؟
28.
لا إيه بس الرقم اللي عندنا كم؟ 30 صح؟
أكثر من 4 6. So it's
إيه
chronic.
لا إذا لو إنه كرونيك كم مفروض يطلع الرقم؟ 4 ضرب 4 كم؟
16.
إيه 16 زائد 24 كم يطلع الرقم؟ تقريبا ها 40 صح؟ 16 يعني 40 صح؟
صحيح.
إيه فلا هو 40 ولا هو 26 هو بينهم صح ولا لا؟
صحيح.
بمعناه ان البيشنت هذا عنده chronic يعني عنده chronic problem وعنده acute problem يعني يعني غالبا ان الباي كارب حقه الطبيعي يمكن بدل 24 26 لان عنده chronic problem اللي هو COPD واليوم جاينا acute problem فإتس acute إنه on chronic بس it's not important بس عشان أشرحها لك أوكي
تمام. شكرا.
ما مش next step شو step number 4
نشوف الانيون جاب.
حلو
الصوديوم ناقص الكلورايد ناقص البايكارب.
إيه. الصوديوم ناقص مجموع الكلورايد مع البايكارب صح ولا لا؟
ايه دقيقة احسبها دكتور.
اوكي انا بحسبها لك اوكي سو اتس 12 فمعناها ايش معناها؟
نورمال 12 از نورمال فور انا.
نورمال سو ما عنده انايون جاب ميتابوليك اسيد صح؟
لا ما عنده.
This guy زي ما قلت has a primary respiratory acidosis. Most likely the cause is acute and chronic COPD exacerbation. Acute and chronic صح ولا لا؟ غالبا إنه عنده COPD exacerbation.
يعطيك العافية دكتور. شكرا.
عافاك الله يوسف شكرا لك. طيب يعني أتوقع باقي لنا 2 more cases. أو يمكن هذه آخر واحدة. مين يتبرع؟ أجل نبدأ بالدور إذا ما حد يبغى يتبرع. أحمد رمضان كيف حالك؟
اهلا دكتور.
هلا وسهلا كيف حالك؟ هذا الدور عليك.
الحمد لله بخير. تمام.
Yeah, we're gonna take case 5. So this is a woman with Crohn's disease who presented with fever, vomiting, and diarrhea. Her pH is 7.36. Her CO2 is 22, and her bicarb is 14. So take me through this acid-base disorder. So what's step number 1 حقتنا؟
اوكي دكتور راح نشوف البي اتش عشان نحدد اذا انه اسيد ولا الكلاين ويعني 7.3 it's acidemia.
Okay, so it's an acidemia. So what's your step number 2?
Primary or respiratory and compare between the pH and CO2 and also the CO2 is it's not 40 or more, so it's metabolic.
Okay, so they both go in the same direction, so you think it's metabolic. Yeah. So إيش معناها إن عنده metabolic acidosis صح ولا لا؟
metabolic acidosis.
Okay, so what's your step number 3?
the compensation.
اوكي the compensation. ايش المعادلة؟
شلون دكتور؟
وش how do you measure the compensation؟
CO2 مع البايكار.
اوكي في لها معادلة صح؟
مم.
واللي هي تذكرها؟
والله مو متأكد بالضبط دكتور، بس يعني اللي ذاكر بالضبط انه كأننا نطرح ال CO2 من رقم او من شيء، وبعدها نجمع الناتج مع البايكار، شيء كذا.
لا ما أدري لا so المعادلة هي so your expected CO2 level should be your measured bicarb level plus 15. فكم
اوكي سوري.
بكم الرقم يطلع؟
الرقم بايكارب
14 زائد 15 كم المفروض يصير؟
يقصد 29.
29 والCO2 عندك كم هنا؟
22.
إيش معناها؟
شلون
سؤالي
دكتور؟
لك الرقم اللي احنا حسبناه is 29 صح ولا لا؟ المفروض يطلع 29 صح؟ الرقم اللي موجود في جسم المريض 22. Is this appropriate compensation ولا لا؟ Yes or no؟
يس.
شلون؟ لا it's no. لأن if it's appropriate ال CO2 المفروض يطلع كم؟ يصير 29.
يصير 29 تناسب
بس
معه. طيب
هنا كم الرقم هنا؟
22 نازل.
It's not appropriate compensation. فمعناه أن عنده another disorder. So عنده respiratory alkalosis.
respiratory.
Okay. So show your step 4.
شلون دكتور؟ step 4.
شو step 4؟ So step 4 is you want to calculate your anion gap. So your anion gap should be your sodium minus the sum of your chloride plus your bicarb, which is equal to 12. So my anion gap is normal. So this patient has non-anion gap metabolic disorder. Okay, but then step 5, chloride should be equal to decrease in bicarb, which is not true. بمعنى أن عندك metabolic acidosis. So basically this lady has a non-anion gap metabolic acidosis, then عندها Crohn's, she have diarrhea, she has fever, so that makes you breathe faster. معناه أن عندها respiratory alkalosis وعندها برضو metabolic alkalosis لأن she's vomiting and she's losing her HCl. Okay.
Thank you.
شكرا. طيب مين يجيني طالع هنا؟ في أحد يبغى ياخذ آخر كيس؟ Any volunteers؟ طيب نسي، خلينا ندور مين. طيب مصعب، معنا مصعب ولا يسنوز ضاف؟ أهلا مصعب. Do you wanna تبغى تتبرع؟ You wanna try to take this؟ هذه last case. Let's go. يلا unmute yourself and let's go. كيف حالك مصعب؟ طيب تكلم في البنك، صوتك ما أنا سمعت، تتكلم. كيف حالك؟ طيب بما أن عندك technical problem وما تتكلم، بخليك تحلها بالشات، ما في فكة مني ترى. So I'll tell you the case and I want you يا مصعب to answer it. So we have a patient with diabetes and cirrhosis who present with vomiting. His pH is 7.46. His PCO2 is 17 and his bicarb is 15. So step one, what's the problem here? Exactly. So we see, is this acidemia or alkalemias? So what do you see? Alkalemia, perfect. So what's step number two? Exactly. Is this metabolic or respiratory? What do you think is going on? Okay. So this is a respiratory disorder لأنه the pH is going up with CO2 is going down, so they go in opposite direction. So most likely it's a respiratory acid, respiratory. So he has respiratory alkalosis. So إيش compensation؟ إيش المعادلة؟ So this is our step 3. صح ولا لا؟ Is the compensation appropriate ولا لا? Tell me, is this a appropriate compensation ولا لا؟ طيب أنت وعبد الرحمن اختلفتوا. عبد الرحمن يقول يس وانت تقول لا. إذا نتذكر المعادلة. So every 10 decrease in CO2 you expect your bicarb to decrease in 2 by acute ولا 5 by chronic. So CO2 حقنا الطبيعي 40 والآن هذا تقريبا أقرب شيء 20. فمعناها if it's acute problem your bicarb should be 24 ناقص 24 so it's not 40 ولا 5 يعني ولا 24 ناقص 5 which is 14 which is around this number. So most likely this is a chronic. So this is most likely an appropriate compensation. صح ولا لا? So we'll say this is yes, an appropriate compensation. And then last step, the step number 4, what we're going to see, your anion gap. نحسبها بالمعادلة اللي هو your sodium minus the sum of your chloride plus your bicarb. Your chloride is 84 and bicarb is here. والرقم يطلع 34. So معناها this guy has an anion gap exactly. Musab, sorry. This guy has an anion gap metabolic acidosis. طبعا step 5, which I don't expect you to memorize, it just you want to calculate your delta gap. So delta gap اللي هو your anion gap اللي هو 34 ناقص 12 ناقص مجموع ال 24 ناقص 15. So it's gonna become 15. معناها this guy on top of his respiratory alkalemia, on top of his metabolic acidosis, he also have metabolic alkalosis. So this guy usually have a chronic respiratory alkalosis لأن عنده cirrhosis. So the patients اللي عندهم cirrhosis, they usually breathe faster than others. He have an anion gap metabolic acidosis لأن عنده DKA. Okay, and he's diabetic. He's not taking his insulin, and most likely he have metabolic alkalosis too because he's vomiting and he's losing hydrogen chloride from his gut. أتوقع this is the end of our talk, so hopefully ما كنت ثقيل عليكم. So I hope it was easy. So I'll send you a lecture. You should go through this. You should go systematic, go through the step, memorize the practical cases. Okay. Before we finish, anyone has any questions? Okay. Hopefully you understood. Wasn't happy بالمشاركة. توقعتكم you're gonna be more active, guys. Maybe الموضوع ثقيل شوي, but I think it's easy if you go through the steps. So I want you guys انكم just go through this lecture again. Hopefully I'll send it to أستاذ ريهام اليوم بعد شوي, and I want you to go through it again. So if you don't go through it again, you'll forget it. So I expect you to go through it today. شكرا جزيلا لكم شباب, يعطيكم الألف عافية. يلا, السلام عليكم.